Imagine, you're a young woman between the age of 15 and 35 with a bright future ahead of you. But instead of exploring your passions or starting a family, you're struggling with extreme fatigue, palpitations, fainting, which forces you to rely on a wheelchair, and you're even advised not to get pregnant. These are just a few of the daily challenges faced by patients with IST disease and POTS disease. Why? Because the heart is beating too fast. IST stands for inappropriate sinus node tachycardia, and POTS for postural orthostatic tachycardia syndrome. These two similar chronic conditions occur in approximately 1% of the population. They are related to miscommunication between the brain and the heart. With IST disease, the heart beats too quickly, even at rest, leaving these patients absolutely exhausted. With POTS disease, the heart rate increases excessively when standing up, causing patients to feel dizzy and potentially lose consciousness. But so far, we don't understand exactly what is causing these diseases. While there is medication available for both conditions, not all patients respond to it. Until recently, there was no known cure for these patients. Luckily, two pioneers in the field developed a new procedure called a hybrid ablation procedure, which essentially uses heat on certain regions of the heart to create new electrical pathways that help restore a normal heartbeat, with promising results. You can imagine that using heat on the heart carries a certain risk of causing damage to other structures, specifically the sinus node, also known as the natural pacemaker, which is responsible for a regular heartbeat. This could result in needing a pacemaker device, a complication that should be avoided at all times. That's where our team of doctors and medical engineers comes in. We are using 3D printing technology to solve this issue and to completely eliminate the risk of causing damage to the sinus node. We developed a 3D printed model of the sinus node, completely customized to the patient. By placing this 3D printed model on the heart during the operation, the cardiac surgeon can easily identify which region to avoid. This technique will allow other teams all over the world to safely perform this ablation procedure. And what about all those girls and young women? It's our mission to provide a better quality of life, allowing them to pursue their passions and focus on their dreams without the limitations of a fast and furious heart.